The excessive heat of summer, of course, can send our pulses racing, cause us to sweat a little bit more than usual. But when do these heat-related symptoms become dangerous? Well, joining us now to discuss the signs and the symptoms of heat stroke and, more importantly, how to stay safe during the summer months is ABC News contributor Dr. Chris Magovern. Dr. Magovern, thanks for being with us today.
Great to be here, Dan.
Okay, so what exactly is heat stroke?
Heat stroke, most simply put, is a medical condition that occurs when your body overheats to a critical temperature, 104 or 105 degrees. And when you hit that threshold, you begin to see organ damage. And once you see organ damage, it can be fatal. Our body is a very sophisticated machine. We live at about 98.5 degrees, and we're pretty good at regulating our temperature. When it gets cold outside, we shiver, and that warms our body up. When it's warm outside, we radiate heat and we perspire. And when we perspire, the perspiration evaporates and that cools us down. But Dan, when it's 105 degrees out and humid and you're exerting yourself, the environment becomes overwhelming and your body just can't keep up.
105 for a prolonged period of time, or just as soon as it hits 105, that is when you can be considered having a heat stroke?
You know, Dan, there's no magic number. It's really a combination. Whenever you're in an environment that's warmer than your body, which is 98.5 degrees, you will overheat. So it could be 100 degrees. It could be 99 degrees. The more humidity and the more you exert yourself, the worse it becomes. So
we've all worked outside. We've all played outside when it's been hot out. And obviously, it's tough to do anything. We're sweating, get more lethargic. But how do we know when those symptoms turn into something more serious like heat stroke?
The symptoms that you need to look out for are really pretty straightforward. And heat stroke doesn't occur right away. It takes generally half an hour for it to develop. And you develop what's called heat exhaustion first. Everyone's had heat exhaustion. You're hot. Your skin is red. You're perspiring. You feel a little winded. You may feel your heart racing. You may feel a little dizzy. Your temperature generally at that point is 101, 102, 103 degrees. That's heat exhaustion. The problem is that if you tip the scales a little bit further and you hit 104, 105 degrees, your organs begin to fail. Your gastrointestinal tract may quit. You may feel nauseated. You may feel like you need to vomit. Your skin, which is an organ, stops working. And instead of perspiring, paradoxically, your skin becomes completely dry. And one of the telltale signs, Dan, is your head. As your brain gets overheated, it doesn't work properly. So one of the signs of heat stroke that you have to pay attention to is confusion and lethargy. And if any of those are the case, you have a medical emergency. And if left untreated, it could result in a coma, seizures, and death.
So obviously serious repercussions for this. So the symptoms, not only physical, but also mental as well. And it always is surprising to find out that when you do reach that point where you've stopped sweating, you have reached that point where it is clearly dangerous.
That's a dangerous problem, and you need to act, and you need to act fast. In the hospital, when we have patients that come in with those conditions, we can cool them down quickly. With ice, we insert IVs that run cool fluid. The best effective way in the hospital is to wet the patient and apply a fan. That evaporation effect works very, very well. When you're in the field, you have to think out of the box a little bit. You have to get the victim in the shade, take some clothing off, hose them down with a garden hose, find some ice. If you've got ice, apply it to the neck, under the arm, and the groin. The reason for that, Dan, is that that's where the blood vessels are more superficial. So you will cool down the blood faster in those locations. And then obviously give them some cool fluids if you can. And as long as the victim cools down and isn't exhibiting signs of mental status changes where they're confused or their skin is dry, you're probably headed in the right direction.
Okay, now, and I'd heard this before, and you correct me if this is wrong, but I'd heard that there's a possibility of actually sending your body into shock if you do try to cool it down too quickly. Is that true?
Yeah, that's not true. That's a great point, Dan. What people are concerned about is that if I took you and you were overheated and I threw you in an ice tub, you may begin to shiver right away just because of the ice touching your skin. And that very act of shivering may warm your body up a little bit more. That really has been disproven over the years. So don't worry about cooling someone too quickly. Don't overthink it. Get anything on them as quickly as you can. Get it done quickly. All right, let's talk about athletes. Obviously, at this time of the year, people are starting to head back to school, trying to get ready for the upcoming fall season. And we hear so many times the tragic events involving school football players, any kind of athletes that are practicing out in these hot temperatures. When is it too hot for kids? Well, That's a hard call. It depends on the humidity. It depends on how much they're exerting themselves. But you're absolutely right. We worry about children and older individuals, but we really worry about the athletes and the football players in particular, because they start their practices in August when the weather is hot. The fields, many of which now are AstroTurf, can reach temperatures north of 115 or 120 degrees. They're wearing heavy padding, which doesn't breathe. And they're big guys, and big guys are well insulated. It's a lot harder for a 300-pound lineman to cool off than it is a 150-pound place kicker. And it's also a macho sport. And the players are less likely to say, "Coach, I don't feel well. Do you mind letting me sit out a minute?" So that's part of the reason we see so many of these accidents in football players.
And you know, sadly, we also hear that people are trying to condition themselves, or trying to toughen up, in other words, by staying out in these hot conditions. Aside from staying in air conditioning all day long, how can we prevent heat stroke in general?
The fact is, Dan, this is an absolutely 100% preventable condition. So you just need to be heads up about this. And you need to think about it. You think about, first of all, what you're wearing. You should wear lightweight clothing, you should wear loose clothing, and light colored clothing. Not a black jersey or a maroon jersey, but a white jersey. If your jersey or your shirt becomes saturated in sweat, you can't cool off. You can't evaporate the sweat. So if your shirt is soaked, change it. You need to hydrate. Because if you can't hydrate yourself, you're not going to be able to sweat. If you can't sweat, you can't cool off. So those are two important features. Hydrate with water. It may take a liter of water every half hour. That's how much you may need to drink. Then you have to be sensible when you go out, obviously. Don't go out in the middle of the day. The worst time of day is between 2 o'clock and 4 o'clock in the afternoon. So get out in the morning, get out in the evening.
All right. Dr. Magovern, thank you so much. Potentially life-saving information. Certainly going to make people a lot more comfortable as well with the idea of preventing heat stroke altogether. Now, for more information about this and some other tips on how you can deal with the potential of heat stroke, you can log on to the health page at abcnews.com.